her passion for climate change and health and the nexus between the two has taken her to do a Masters in Public Health in London, to work for the World Health Organization, and thankfully back to Australia, where she's very much involved in DEA's work in this area. Thanks, Sallie.
Okay, thanks everyone. I'll just start by saying, as someone from WA and after hearing Rob Moody's speech, that I'm definitely going to use my experiences in Melbourne to try and influence policy for sustainable transport and the health code benefits in WA. Last night on the tram on the way home, I had the driver had a very interesting voice, and he said, "The next stop will be the very interesting Melbourne Central." And so I thought that was great, and walking down out of the tram and seeing everyone give him a big thumbs up, and then he gave a big thumbs up back, I thought, well, that's definitely something we need to implement in Perth. So to begin, we've had a lot of talks over the last couple of days about what the problem is with climate change. And I suppose some of you may be thinking from that, well, what can I do in my career to further pursue that as an interest? And basically that's what I'm going to talk about today. So I remember being in a similar position to quite a lot of you, I presume, when I was about fourth year, thinking, well, how can I actually take this forward as a career? So I thought it might be useful today to discuss my story just as one example, and then talk briefly at the end about the career options available to you. So I suppose my story started with having that light bulb moment, which I think a lot of people have along the way, realising that climate change is a huge issue that we need to deal with. And for me, that was when I was in year 6, so about 11 years old, so quite a while ago. But I remember the teacher sort of discussing global warming, and I thought at that point, well, that problem has the potential to be a huge issue for the human race. I mean, above most other issues, really. And I have felt like that ever since that time. So, I mean, I did a lot of environmental things when I was at school. But towards the end of school, I decided to do medicine, and then did medicine. And when I was in third year, I think I discovered DEA, and I thought, wow, I'd been hoping to discover that. And I thought, here's a group that actually realised that we won't have any health if we don't look after the planet and think about the bigger picture here. So for me, that was fantastic to discover other people with a similar thinking, and I suppose that's where Harry's thoughts yesterday, where you sort of feel like you're the only one who feels like that. It's certainly not true, and you guys can see that here today. So when I was in, say, fourth year, I started to think more about how I could pursue a career in this, and I contacted DEA, who put me in touch with Tony McMichael, who's probably, as you know from Rob Moody and Fiona Stanley, he's sort of the world leading expert on the health impacts of climate change. And he advised me at that point if I could possibly wait, and suggested doing a Masters in Public Health in London as one great path to take. And they have a lot of interest in London in environmental health, and particularly climate change and health. And Tony actually worked there for a long time previously. So also Colin Butler, who's another researcher in climate change and health, advised me around that time that if you could possibly get to London and not do it as an external student, the opportunities that you get from going there and meeting all the different people and contacts and organisations are very valuable. So, I mean, I decided to hang on and and finish medicine, and I did my internship in Perth, and then I moved to Scotland, where my partner moved, and worked there as a resident for about 8 months. And I decided, since I was in the UK, that I should use this as an opportunity to try and get into the Public Health Masters. So September of 2011, I started a Masters of Science in Public Health, and I chose to do the Environment and Health stream, but there's lots of streams you can do in London. And this is the school. This is the front door, obviously, and it's quite an interesting building because it has bugs and mosquitoes all along the top of along here and here. So it's quite cool, and they're all painted gold. But I mean, it was a fantastic experience. I met people from all over the world. We had lots of interesting discussions about different health systems. Just as an example, there was a lady there who was a doctor in Yemen, and just hearing about the challenges they have, I mean, are completely different to Australia. So it's very valuable to broaden your mind and find out how other countries do things. And this is just it's just a list of the different units I did. These are sort of basic units that everyone does. And then towards the end of the degree, I sort of specialised in my particular interest, which was environment and health. And I mean, that's been very useful in my current work for DEA, particularly environmental epidemiology, but just having a broader understanding. And this unit, health policy, process and power, I mean, that's links to a lot of what we're doing today. We did a lot on framing and looked at the wider picture of how politics works, basically a political science unit. At the end of the Masters, I did a 3-month thesis, and my project was entitled Estimating the Health and Greenhouse Gas Impacts of Electrically Assisted Bicycle Use in Perth. And sounds a bit wacky, but actually it wasn't. And it uses techniques where you sort of do a dose-response relationship and measure the estimated impact if you assume. I assumed if a certain number of people in a hypothetical policy scenario shifted from using a car to an electric bike to commute to work every day. And this is sort of based on a technique that the WHO has. It's called the HEAT tool, Health Economic Assessment Tool, which is available online. You guys can look it up if you like. Basically, you can model in your city if this many people took up walking and cycling, what would the health impact be? And then they go on to say, well, what cost would that have? And obviously, working things out in terms of cost can sometimes be more influential for a policymaker than saying this many people will die, or measuring in health impacts. So I suppose one of the important messages is if you ever do any of these similar opportunities, I mean, obviously it doesn't have to be in London, to make the most of those opportunities while you're there. So while I was in London, I went to a lot of these different organisations. Overseas Development Institute was just one of lots of international development organisations in London, so that was a great opportunity to go and see some of their talks. Population Matters, NHS Sustainable Development Unit, I went up and met them in Cambridge and sort of went to one of their conferences, became more aware of what they were involved with. London School of Economics, that's where Nicholas Stern worked, so that was great to go to some of their seminars. And I went to a conference called Planet Under Pressure, which was a conference leading up to the Rio Sustainable Development Conference, which is run by the UN as well. So I suppose through seeking all those opportunities, I applied for an internship at the WHO in Bonn in Germany, which is where they have a centre for environment and health. And after I finished in London, I went there. And I didn't realise at that time, but Bonn is actually the centre for a lot of organisations within the UN related to sustainable development or environment. So that was fantastic to get exposure to them. One of those organisations is the UNFCCC, or the UN Framework Convention for Climate Change, which does all of the Copenhagen talks and came up with the Kyoto Protocol. So meeting some of those people was a pretty fantastic experience. So that's the UN building there in Bonn, and it looks out over the Rhine River. And it's interestingly, that used to be the government offices when Bonn was the capital of West Germany, and that's now shifted back to Berlin, and they've given that office to the UN to use. So I think the WHO office was on the 7th floor or so. So while I was there for a period of 3 months, worked on various different things, and this was my office looking out over the Rhine, so it's pretty specky. Yeah, that's my office there, and I worked on various different projects. So the Sustainable Development Unit, the WHO is looking at rolling out that model across the whole European region. And I worked on the health impacts of climate change and what policy responses there needs to be, which was considered by the European Commission, and also worked on a book chapter there. And at the end of that, I went to a 2-day conference on environmental health economics. And that's just some of the other things I did in Bonn. So this girl was from Hong Kong, this girl's from Korea, a medical student from Korea, and we went and did a few social things out in the surrounds of Bonn. So there's a lot of vineyards along the Rhine. So we did a bit of a day trip out there. So at the end of that time, I sort of thought, right, well, it's fantastic to have that experience, but my real passion is for where I'm from. So I decided to come back to Australia, and last year I did another RMI year full-time. So that's actually only my second year postgraduate. And this year, This year I've got a part-time role as a resident medical officer, and then most of my other time is spent working for or volunteering for DEA. So still thinking at the moment about where my path might lead next, but it's certainly only one. What my experiences so far are only one path that you could take. So I wanted to just have a quick discussion, and there's lots of other people in the room who have taken various different paths. So if any of them would like to also contribute to this, that's great. But you can do public health, which Marion Kerry has done from DEA, and you can stay in clinical roles, and I did just consider doing infectious diseases for a while, or general practice. You can lead to or go more for activism or advocacy, which is what I'm currently doing, and combining that with a clinical role. And I think this one's really important. And I mean, you can also, obviously a lot of these link together, like if you do public health, you can use that to become an activist. Research, which is what Tony McMichael did, and Fiona Stanley obviously uses that well to then link into advocacy. Obviously paths in sustainable healthcare policy. So I think doing the Masters in Public Health was very good for this. A lot of people working in the WHO have got a background in public health. And you can work in government as a policy advisor, and politics, which has been topical today, and there are obviously many more. And I'd be more than happy to discuss any of those options with anyone further.
Thanks very much, Sally. We do actually have time for a couple of quick questions in this forum, if that would be okay. We have one by text message if the microphone drivers want to walk somewhere. This you may have just covered a little bit, but I think you could probably expand on it a little bit. Sally, are you still able to do any clinical work? And if so, do you still enjoy it, or do you miss it if you're not able to?
Okay. So I think that's a very individual question. Personally, I've become more and more interested in public health and shifting towards a preventative model. So I am working obviously half-time as an RMO at the moment, but I think my path will lead more towards public health in the future. But that's not to say that, I mean, a lot of people get a huge amount of enjoyment out of doing clinical medicine, and I think it is possible to combine the two depending on what specialty you do. General practice is obviously one where you can work part-time and still pursue other activities.
And we have a question in the middle there.
So that's really inspiring to hear what you're doing with your career. I also have a career where I do a little bit of clinical, a little bit of public health, so there's plenty of opportunity. And also, it doesn't have to be at the same time. Yeah, you can do a year of something and a year of something else, and you've got a 50-year career ahead of you. But my question is, how are we going to get this critical issue into our undergraduate curriculum so all doctors know of the critical importance of looking after the environment?
Yeah, great question. DEA and WA certainly have been active in trying to get it on the curriculum. There's a new postgraduate course there as opposed to undergraduate. It's difficult, and I think you guys all need to put pressure on your universities to put it in the curriculum, because this is a mainstream issue and it has to be dealt with. Yeah, and I suppose when I was in London, I sort of realised that, a little thing about this, that we need many more people to become active if we're going to have a good democracy. People sort of have said to me, oh, it's great that you're getting involved in politics and it's such a hard field to go into, but I would argue that all of us are part of politics, and unless we become more active in that process, decisions will continue to be made without us without us basically, and towards the vested interest side. So yeah, for that reason, I would say advocacy and activism is very important as a medical student.
Thanks very much, Sally. We might close it there, but I'm sure Sally would be more than happy to have her brains picked afterwards. Oh, sorry, there wasn't.
Great. Thanks very much indeed. Terrific to hear your journey. And I'm a public health physician, and I encourage you to become one. The other area that I think is growing in Australia, and certainly is a large player in America, is the philanthropic sector. The philanthropic sector in the United States is responsible for 9% of all employment. And there are very large foundations. For example, the Blomberg Foundation employs a public health advisor. They give large amounts of money towards tobacco or anti-tobacco. It's like Richard Di Natale's thing saying he's in health, gambling, and I think it's anti-gambling. So I think the philanthropic sector is a really important and growing place where people are trying to invest money for the best outcome, particularly for health. But there's and the environment actually gets the smallest buck there. It only gets about 3 or 4% of the philanthropic dollar. So they're very, very careful about how they spend it. So I see that as a field of growing opportunity for employment for knowledgeable people like yourself.
Yeah, I'll just say briefly, I think it's an important crossover to have both an environment and health background. There's a lot of people working in the environmental field alone, but your skills in both are very, very valuable. So, yeah.
All right, thanks very much, Sally.